I'm Eric Campbell. I'm Associate Professor of Medicine at the Institute for Health Policy at Harvard Medical School and Massachusetts General Hospital. This is a report of the Institute of Medicine. It concerns understanding and developing some recommendations regarding the nature, extent, and consequences of conflicts of interest in medical education, in the practice of medicine, and medical research. It was funded by a group of organizations, including the National Institutes of Health, as well as other nonprofit foundations. Our report, as coming from the Institute of Medicine, cannot comment on any individual piece of legislation. What we can say is that our recommendation about mandatory disclosure of conflicts of interest involving people engaged in medical education, research, and patient care is similar to that that's proposed by Senator Grassley, but we cannot comment on any individual piece of legislation. It came about because there's been a long history of policy interest in getting a better understanding of the nature, extent, and consequences of relationships in medical education, research, and patient care. The report of our commission talked about medical societies in terms of their role as developers of clinical practice guidelines. And what we said is that people who develop clinical practice guidelines should not accept direct funding from companies, that's either pharmaceutical companies or device companies, to support the development of clinical practice guidelines. Clinical practice guidelines are really a set of guidelines that doctors can use that help them practice evidence-based medicine. And what we did allow for is indirect funding, is that the organization can accept the funding, but the funding cannot be given directly to support the development of the clinical practice guidelines. Our committee considered the role of industry in continuing medical education. And we noted that industry funding is significant. In fact, more than half of the funding for all accredited continuing medical education in the United States comes from pharmaceutical companies. And we were aware of this, and the committee eventually developed a recommendation that suggested in the next 2 years that a consensus commission be developed to come up with a new mechanism to reduce the amount of influence that drug companies and pharmaceutical companies and device companies have in continuing medical education in the United States. We didn't specify a set limit on the amount of money. What we called was a fair and reasonable price, a fair market price. But what we did say was that our committee was very much aware that certain kinds of relationships, especially relationships that involve research and consulting, is an important way that doctors can interact with drug companies. So our committee suggested that, in fact, consulting relationships should not be banned, but rather they should be disclosed and they should be managed, and that they should be based on written contracts. Well, I think these institutions should be applauded for taking the voluntary action. But at the same time, I think that the fact that our committee recommended a mandatory system for disclosure suggests that voluntary actions are not sufficient, and we think it needs to be done. Our committee didn't examine and try and determine the reasons why these places have done it. I personally think oftentimes the drug companies, for example, have seen the handwriting on the wall. They know that legislation is likely coming, either at the institution level, the state level, or the national level, and it's simply an attempt to get ahead of the curve. But one thing I can say is that we hope that the recommendations that are there will guide policy. That's our intent. We hope that it will guide the policies and activities of individual institutions like medical schools and teaching hospitals. We hope that it will guide the activities of legislature and Congress. And so, that we hope the ultimate goal is policies which are designed to essentially ensure that certain forms of relationships with industry can continue, that we can get their benefits and guard against their risks. And ultimately, we can preserve the public trust in medicine and medical education, and at the same time allow for what are often very necessary relationships. And at the same time, we can get rid of the relationships that the committee considered to be unacceptable.